My topic for discussion today is migraines. In my audience, I have my mother, my brother, and my boyfriend. How many people in this room get headaches? Are they so severe that they disrupt what you're doing? Some of you may be suffering from a migraine instead of a headache. Many people are wrongly diagnosed with headaches when they actually have migraines. I've suffered from them since I was in high school, and they've only gotten worse since I was first diagnosed. It is important to know the signs and symptoms of a migraine, what causes them, and how sufferers deal with them on a daily basis. First, to understand a migraine, you need to know what exactly it is and how it affects the body. A migraine is a complex condition with a wide variety of symptoms. For many people, the main feature is a very intense or severe headache. Migraines usually affect one side of the head, and they often have accompanying symptoms in addition to head pain. These symptoms include disturbed vision, nausea, vomiting, sensitivity to light, sound, and smells. A migraine attack can be divided into 4 or 5 stages that lead on from each other. The first stage is the warning stage. This can be described as certain physical or mental changes such as tiredness, food cravings, mood changes, feeling thirsty, neck pain. These feelings can last up to 24 hours before your migraine. The second phase is not always present, but it's called the aura stage. Auras often start within an hour or so of the headache portion of the migraine. They can affect any of your senses, including blind spots, vision loss, seeing flashing lights, hallucinations, tingling or numbness in your face or body, weakness, or trouble finding words or speaking. The next stage is the main attack stage. This is the headache portion of the migraine. This normally involves head pain, which can be severe or even unbearable. The headache is typically throbbing and made worse by movement. Nausea and vomiting often occur at this stage, and the sufferer may be sensitive to light or sound. When a migraine comes to an end, it either slowly fades away or stops suddenly. This phase is known as the resolution stage. Medication can be used to relieve and end the migraine. In addition, many sufferers feel relief after getting sick or taking a nap. The final stage of an attack is the recovery stage, which can last for several hours or several days after. Sufferers often feel symptoms similar to the first stage or even mirrored symptoms, meaning if they didn't have an appetite on the onset of a migraine, they now may be very hungry or crave certain things. Migraines can hit you as often as several times a week or as few as a few times a year. They can last anywhere from a few hours to a couple days. Migraines happen more often in women than in men and can develop from age 5 to 35. Now that we know what a migraine is and what the symptoms are, we can start to understand what causes them. However, migraine headaches are a bit of a mystery. Researchers have identified possible causes, but they don't have a definite explanation. Migraines are often undiagnosed and undertreated. Evidence has shown that causes of migraines could be irregularities in the brain's blood vessels or vascular system, a genetic predisposition, abnormalities of chemicals and nerve pathways in the brain. The main theory that evidence seems to support is that the dilation and constricting of the blood vessels. During the time before the headache starts, the blood vessels in the brain get smaller and allow less blood to flow. When the headache begins, your blood vessels become dilated and more blood flows through. This is the stretching, and that's what causes the headaches. In addition, serotonin is thought to be a main cause of migraines. High doses of serotonin are found before migraines, and low doses of this hormone are found during the migraine. Doctors have also identified some triggers that can cause migraines. These triggers can be depression, stress, lack of food and sleep, hormone changes, weather changes, certain foods and beverages, and bright lights. Now that we know what the symptoms and causes of migraines are, we can start to understand how sufferers deal with them on a daily basis. Treatment for migraines ranges from a very simple home remedy to services provided by a doctor. One simple treatment I use at the onset of a migraine is an ice pack. I often place the ice pack over my forehead and lie down for a little while. Another option is to lie down in a dark, silent room. However, if you're out and about in public, you're working or at class, this isn't a feasible option. Instead, I often wear sunglasses to help my eyes with the bright lights if I can't go into a dark room. In addition, there are several topical creams that can be massaged into the head and neck, specifically over the temples and forehead. This is one that I use frequently. The combination of the pressure massage and the topical cream can really relieve the migraine pain. Migraines can also be treated with two types of medications. One group of medications are taken at the onset of a migraine and are used to help get rid of the pain. The other group is known as a preventative medication, and they're used to stop headaches before they happen. Since I was first diagnosed with migraines, I have been prescribed over 15 different medications to help relieve and prevent them. I am on 3 different medications right now, and I regularly see a neurologist to assist with the treatment of my migraines. The next treatment is for people who have tried everything in the books. This treatment is Botox injections. They are designed specifically for migraine sufferers who have 15 or more headache days a month, with a headache lasting at least 4 hours or more. It is a quick, in-office procedure performed by a doctor trained to specifically inject Botox for migraines. Patients receive a series of injections at specific sites on the head and neck to decrease the severity and frequency of future migraine attacks. I recently learned about this treatment at my last office visit with my neurologist. He informed me that this should be my next step because I've tried everything else there is out there and haven't seen any improvement. In the next month, I will be researching this treatment more and deciding if it's best for me. In conclusion, migraines are a complex condition. All the causes of migraines aren't known yet. Having a migraine can drastically interfere with your productivity and reputation in your life. Now that you know the signs, symptoms, and causes of migraines, how many people in this room think they may have them? If you think this is you, speak up for yourself and talk to a doctor. If you know someone who may be suffering with migraines, inform them of what you've learned today. Thank you for your time.